Today's focus is on the primary survey using Doctor's ABC method, a structured approach to assessing any casualty quickly and safely. D stands for danger. Check the area for any hazards. Only approach if it's safe to do so. R is for response. Gently shake the casualty's shoulders and ask loudly, "Can you hear me?" If there's no response, continue your assessment. S is shout for help. Call out to alert others or direct someone to phone 999 or 112 immediately. A stands for airway. Check the casualty's airway. If they're unresponsive, open their airway using the head tilt chin lift technique. B is for breathing. Look, listen, and feel for normal breathing for up to 10 seconds. C stands for circulation. If the casualty is not breathing normally, start CPR immediately. If they are, place them in the recovery position and monitor. The primary survey helps you to prioritize life-saving actions and respond appropriately in those critical first moments.